Whether or not Guyana has eliminated lymphatic filariasis as a public health problem will soon be determined through the execution of a Filaria survey 2021, which started on October 25th in regions 2, 3, 4, 5, 6, and 10, and is expected to conclude on December 1st. Among other things, the survey is to assess the acceptability, risk perception, and mass drug administration participation in select regions. Blood samples are being collected from representatives from the Ministry of Health who conducted house-to-house visits to get samples for testing. Filaria test results are then communicated to each participant via text message or telephone call. If anyone is confirmed positive using the rapid test, treatment will commence immediately. Upon completion of the last leg of the mass drug administration program in March 2021, which saw 70% of the country's population being administered filaria prevention pills, Health Minister Dr. Frank Anthony had stated that the achieved target was a qualifier for the complete eradication of filaria in Guyana. He noted that the data will then have to be assessed by representatives from the World Health Organization before the certification is issued, the only way the country can be declared filaria-free.
We've been able to accomplish this feat of 70% of our population taking the tablets. The next step in this process is that we'll finalize those numbers. Then we'll invite PAHO WHO to send a team in to verify what we have completed. And once they're satisfied and they can verify the numbers that we currently have, then they would certify Guyana as being free from filaria.
However, during his COVID-19 update on Thursday in response to a question posed by this reporter in regards to why Guyana has not received certification for the elimination of this disease by the World Health Organization as yet, the minister explained that the process has not been completed.
We were required to do the mass drug administration, and we have completed those 2 cycles in the endemic areas for filaria. Having completed that, now to ensure that we don't have filaria, we now have to go back to those communities, take samples of people, and do certain tests to ensure, to see whether or not the parasite still remains in the population.
Dr. Anthony outlined that following the completion of a series of tests, the World Health Organization, based on the findings, will validate Guyana for achieving elimination of filaria.
And once that is completed and the results are known, based on those results, then the WHO would use it to make a decision on whether or not they can declare us to be filaria-free. So there are testing that would have to be done this year, and then there are testing that would have to be done next year.
In South America, according to the Centers for Disease Control and Prevention, Guyana and Brazil are the only 2 countries still battling filaria. The process of certifying elimination of the disease is done by an independent international commission established by the World Health Organization. This commission will recommend to the organization those countries that have fulfilled the requirements for certification, as well as advise the organization on criteria, procedures, and process made towards elimination of filariasis transmission. The Commission will also designate a panel of specialists whose members can be assigned to international certification teams. The Mass Drug Administration program to suppress filaria started in October 2019. However, due to the COVID-19 outbreak, the campaign was cancelled in 2020 and recommenced earlier this year. Temika Rodney reporting for the HGP Nightly News.